Brand new poll numbers on the future of the American medical system. Rasmussen reports that asking if you think health care will get better, worse, or stay the same in the wake of President Obama's insurance overhaul, 49% say they see it as getting worse now. Bernard Whitman is a pollster and Democratic strategist, and he's my guest right now. All right, so when you see those numbers there, Bernard, it's not good news if you supported Obamacare.
Well, that's true, but what it underscores, Gretchen, is that the American people really don't have enough information to decide whether or not the law is going to impact them positively or negatively. A new poll by the Kaiser Family Foundation actually shows that a greater percentage of Americans, 56%, say they don't have enough information to determine how the law is going to affect them. More think that they don't have enough information than believe that the law should be repealed.
So those people would agree with Nancy Pelosi, who said that it's just better to pass the bill and then you'll find out what's in it?
No, what I think it means is the administration has got to go out and explain what the benefits of this law are to the American people.
They've been doing that, Bernard.
No, they haven't been. I'll tell you why. When in the most recent poll from Kaiser, when you break down the bill into its constituent parts, 3 and 4 would like to see various elements kept. That is, closing the prescription donut hole for seniors, keeping subsidies in for low-income Americans, a ban on denial of coverage for pre-existing conditions. All of these elements of the bill are soundly supported. And in fact, a Bloomberg poll shows that 51% of Americans say the law may need some small changes, but ultimately they'd like to see how the law is going to work.
Yeah, but the big thing is how the heck are we going to pay for it? And I think if we broke that down in the polls, that's where we would see results like this. So, do you believe that it should be repealed? 55% strongly to somewhat favor repeal. Now, that's more than half of the American public talking about full-scale repeal, Bernard.
But slightly more than that, say, you know what, truth be told, I don't have enough information. I don't really know. I'm not sure how this law is going to affect me. So what the president and the administration have got to do is go on a road show and explain to the American people the benefits of the law, because the polling on this has been clear for almost 2 years. When you break down the law into its individual elements, people like it. But in the absence of understanding actually how the law is going to benefit them, that they can keep their kids on their insurance until they're 26, they're not going to be denied coverage.
I think a huge percentage of people agree with that, because that seems like no nonsense, and everyone gets that. But I got to get to the cost of it, because I think this is the big thing that people disagree about. So look at the results of the poll. Under the new health care reform plan, will the cost of health care go up, go down, or stay about the same? 56% believe our costs are going to go up. And yet, one of the main tenets of this whole sales plan was, hey, Americans, we're going to save so much with Obamacare.
Gretchen, you're absolutely right. And the thing that has actually disappointed me the most in all this is the health care bill should have been explained to the American people as an effort to rein in health care spending and help to draw down the deficit. And in fact, the Congressional Budget Office came out, and originally their projections were a bit higher, but they've come out since and said, you know what? This law is actually going to reduce the budget deficit by $124 billion over 10 years. Now, frankly, that's not a lot of money, but it certainly says the savings are going to be there. It's not going to increase the deficit. And in fact, it's going to allow individuals to not be trapped in dead-end jobs for fear of losing insurance, and unlock some entrepreneurial spirit in this country, which we desperately need to create more jobs.
I got to get to this next topic, because in the last couple of days, it became public knowledge that the White House was going to be stealthily calling doctors' offices and find out what kind of care they provide and how long it takes to get an appointment. And a lot of people have a problem with this, because they say what they're ultimately going to do now is blame doctors when we can't get these 30 million new patients, or is it 30 billion? 30 million new in when Obamacare kicks in. Your thoughts?
Well, actually, it amazes me, because this type of, it's called mystery shopping, is a standard business practice. Companies do this all the time to make sure that their service is being properly delivered in their stores and across the internet and across the telephone. So the fact that the government is adopting a business model to say we're going to make sure that service is being properly provided and people are following the regulations, this should be applauded. The Bush administration used this for Medicare.
And one of the officials said that it's totally different because they were using it as a quality control issue. My point to you is that the Obama administration will be able to say, when there's a shortage of doctors, look, it's the doctor's fault that we don't have enough doctors, not Obamacare.
No, this is not about a blame game. It's about addressing one of the most fundamental problems in America, and I've worked on this a lot here in New York City. Low-income people have a very difficult time sometimes accessing primary care. This is an effort to ensure that all Americans, regardless of income and regardless of whether they have public insurance or private insurance, have access to the most basic medical care in this country. We are a society that believes in opportunity for all, and everyone should have access to basic care.
You got to wonder how many people are going to want to become doctors in the future. That's all I'm going to say about it. Bernard Whitman, always great to see you.
Thank you, Gretchen, so much.